What is knee pain? How is the knee structured? Having sore knees is normal and isn't typically an indication of anything genuine. There are numerous potential causes, which can go from a basic muscle strain or tendinitis, to some sort of joint inflammation. Some of the time a reason can't be found. Knee torment can regularly be treated at home and you should begin to feel better following a couple of days. As you age, getting knee agony may turn out to be more normal. You're additionally more in danger of getting knee torment in the event that you are overweight. Knee agony may here and there be the consequence of a games or other injury. The knee joint's fundamental capacity is to twist, fix, and bear the heaviness of the body, alongside the lower legs and hips. The knee, something beyond a straightforward pivoted joint, nonetheless, likewise wins and turns. To play out these activities and to help the whole body at the same time, the knee depends on various constructions including bones, tendons and ligaments. Bones. The knee joint includes 4 bones. The thigh bone or femur involves the top bit of the joint. One of the bones in the lower leg, or calf region, the tibia, gives the base weight-bearing part of the joint. The kneecap or patella rides along the front of the femur. The leftover bone in the calf, the fibula, isn't engaged with the weight-bearing part of the knee joint, however gives tendon connections to strength. Ligaments. Ligaments are dense fibrous bands that connect bones to each other. The knee includes 4 important ligaments, all of which connect the femur to the tibia. The anterior cruciate ligament, ACL, and posterior cruciate ligament, PCL, provide front and back, anterior and posterior, and rotational stability to the knee. The medial collateral ligament, MCL, and lateral collateral ligament, LCL, located along the inner, medial, and outer, lateral sides of the knee provide medial and lateral stability to the knee. Tendons. Ligaments are stringy groups like tendons. Rather than interfacing unresolved issues bones as tendons do, ligaments associate muscles to bones. The 2 significant ligaments in the knee are, 1. The quadriceps ligament interfacing the quadriceps muscle, which lies on the facade of the thigh, to the patella and, 2. The patellar ligament associating the patella to the tibia. Actually, this is a tendon since it associates 2 bones. The quadriceps and patellar ligaments are now and then called the extensor component, and along with the quadriceps muscle they work with leg expansion, fixing. Cartilage. Cartilaginous designs called menisci, particular structure as meniscus, line the highest point of the tibia and lie between the tibia and the 2 knuckles at the lower part of the femur, called the femoral condyles. The menisci's essential occupation is to give padding to the knee joint. Bursae or bursitis. Bursae are liquid-filled sacs that assistance to pad the knee. The knee contains 3 significant gatherings of bursae. The prepatellar bursae lie before the patella. The pes inserine bursae is situated on the inward side of the knee around 2 crawls beneath the joint. The infrapatellar bursae are situated under the patella. Knee pain home care. Aggravation is the body's physiologic reaction to a physical issue. In treating numerous sorts of knee torment, a shared objective is to break the incendiary cycle. The provocative cycle begins with a physical issue. After a physical issue, substances that cause aggravation attack the knee to help with mending. Notwithstanding, if the injury and ensuing irritation isn't settled, aggravation can turn into a persistent issue, prompting further irritation and extra injury. This pattern of aggravation prompts preceded or reformist knee torment. The cycle can be broken by controlling the substances that cause aggravation, and by restricting further injury to tissue. Some normal home consideration procedures for knee torment that control aggravation and help to break the fiery cycle are security, rest, ice, pressure, and height. This routine is summed up by the memory gadget price. Protect the knee from additional injury. This should be possible with knee cushioning or bracing. A cushion over the kneecap, for instance, assists with controlling the side effects of some knee wounds. A model is a type of bursitis, now and again called housemaid's knee, by forestalling further dull injury to the prepatellar bursae. Rest the knee. Rest reduces the repetitive strain placed on the knee by activity. Rest both gives the knee time to heal and helps to prevent further injury. Ice the knee. Icing the knee reduces swelling and can be used for both acute and chronic knee injuries. Most authorities recommend icing the knee 2 to 3 times a day for 20 to 30 minutes each time. Use an ice bag or a bag of frozen vegetables placed on the knee. Compress the knee with a knee brace or wrap. Compression reduces swelling. In some knee injuries, compression can be used to keep the patella aligned and to keep joint mechanics intact. Elevate the knee. Rise likewise decreases growing. Rise works with gravity to assist liquid that with collecting the knee stream back to the focal dissemination. Prop your advantage when you are sitting, or utilize a chair, which normally raises the legs. Rise works best when the knee or some other harmed body part is higher than the level of the heart. Over-the-counter agony medication. Commonly utilized torment relievers, like nonsteroidal calming drugs, NSAIDs, like ibuprofen, Advil or Motrin, and naproxen, Aleve or naproxen, additionally assume a part in the treatment of knee torment. These medications straightforwardly control torment and, at higher portions, go about as mitigating specialists, assisting with breaking the provocative cycle. Like all prescriptions, nonetheless, these medications have results. You ought not utilize NSAIDs in the event that you object to draining or stomach ulcers or a few sorts of kidney illness. Acetaminophen, Tylenol, can likewise be utilized to control knee torment, however doesn't have the calming properties of the NSAIDs. All things considered, this treatment is astoundingly valuable in numerous sorts of knee torment, like osteoarthritis. When to go to the hospital for knee pain. In the event that you can't put weight on your knee, feel debilitated, or have a fever, or if your knee is red and hot, you ought to consider going to the ER to be assessed by a specialist due to the chance of a break or contamination. Many fractures may require immobilization in a specific position or surgery. Infections need immediate attention. They can be managed but require prompt care. Putting off seeing a doctor may hinder healing. Other signs and symptoms that demand emergency evaluation. Unbearable pain. Pain that does not improve with rest. Pain that wakes you. Drainage. Large wounds. Puncture wounds. Swelling, if you are on a blood thinner, warfarin or Coumadin, or have a bleeding disorder, such as hemophilia. Even in this day and age of innovation, specialists depend on a definite history and actual test more than any single test. The doctor will typically want to know the exact nature of the pain. Knee pain prevention. Knee torment has a large group of causes. Numerous sorts of agony are hard to forestall. However, you can do some broad things to diminish the probability of supporting a knee injury. Stay slim. Remaining thin decreases the powers put on the knee during both games and ordinary strolling and may, as per some clinical exploration, diminish osteoarthritis. Holding your weight down may likewise lessen the quantity of tendon and ligament wounds for comparable reasons. Keep limber, keep fit. Numerous knee issues are brought about by close or imbalanced musculature. Extending and fortifying, along these lines, additionally help to forestall knee torment. Extending holds your knee back from being excessively close and helps in forestalling both patellofemoral condition and iliotibial band disorder. Reinforcing works out, especially of the quadriceps, straight leg raises and leg augmentations are among the recommended works out, can help forestall knee injury and are vital for lessening joint pain and related complexities. Exercise wisely. On the off chance that you have ongoing knee torment, consider swimming or water works out. In water, The power of lightness upholds a portion of our weight so our knees aren't troubled. On the off chance that you don't approach a pool or detest water exercises, at any rate make a decent attempt beating and turning exercises like b-ball, tennis, or running. You may find that your hurting knees will misbehave in the event that you play ball or tennis consistently, however won't on the off chance that you limit your beating sports to double 7 days. Wearing legitimate insurance for the current action can help keep away from knee wounds. When playing volleyball or when laying rug, ensuring your knees may incorporate knee pads. When driving, knee security may incorporate wearing a safety belt to stay away from the knee versus dashboard wounds, just as wounds to different pieces of your body. Thank you for watching. Hope you enjoy this video. Please like and subscribe for more video updates.